Good evening, colleagues, ladies and gentlemen, esteemed guests, viewers online. This event is being live streamed also. Welcome to this fantastic event. My name is Dr. Oliver Morgan. I'm the director of the WHO Hub for Pandemic and Epidemic Intelligence here in Berlin. And it's a real pleasure for me to welcome you all here tonight for this fantastic event, Global Health Transitions 2025, organized by the Ministry of Health of Germany. I think this event is even more special for us, being able to host this event here in the WHO Hub. The Hub, as you may know, we opened our doors here in 2022, and we have really had a great experience and really blossomed in that time. And that's really thanks to the vision and leadership of both Minister Dr. Lauterbach and Dr. Tedros, and thank you very much for your ongoing support for this initiative. If I think back over the last few years, the last time we actually had both the Minister and Dr. Tedros here in the building at the same time was really at the very beginning when we just started. In fact, it was a visit with Dr. Mike Ryan, who is the Executive Director of the WHO Health Emergencies Program, and they came at the very early days of the Hub, and this was actually still a construction site. Since then, a lot has happened, and a lot has happened under the leadership of Dr. Ghebreyesus, who is currently acting regional director in the African region for WHO. The work has been fantastic, the initiatives have been very interesting, and the partnerships have been really incredible. We are working currently with almost 140 member states in our initiatives, and we have also received in the last 2 years over 3,500 experts who've come here to collaborate on a wide range of different projects and initiatives here in the Hub. It's really, in that sense, very fitting for me to welcome you all here for this fantastic event. We have many colleagues from the German government, from the academic sector, from civil society, as well as from industry, and you're all the most welcome into the WHO Hub. It's therefore a real honor also for me to introduce our two keynote speakers who perhaps don't need so much introduction, but it would be a pleasure for me to introduce Professor Dr. Karl Lauterbach, Minister of Health of Germany and a world-renowned academic in global public health, and Dr. Tedros Ghebreyesus, who is the Director General of the World Health Organization. Please give a welcome to both our esteemed guests. May I invite Dr. Lauterbach up onto the stage for his remarks.
Well, dear Dr. Tedros, dear friend Dr. Oliver Morgan, ladies and gentlemen, it's my honor to welcome you today to this event by the Ministry of Health that takes place in the WHO Hub. It's a symbol of our close collaboration between our institutions and the prominent role the WHO Hub in the global health architecture aspires to live up to. In a few years, we will look back at the year 25 as a pivotal year for global health, a year in which one of our closest partners and largest donors has turned their back on WHO, and the freeze of USAID funding has sent shockwaves throughout the world. A year in which essential public health data, that was the word, the most important data very often, on which the world relied, is suddenly missing because US technical agencies have stopped communicating with us. A year in which global health financing has been radically reduced in the face of shrinking international development budgets. Global health is at a crossroads, and WHO is faced with unprecedented challenges that require a fundamental shift from the status quo. And WHO is reacting to this challenge. I would say it is doing so by embarking on a formal process of re-prioritization. It's extremely challenging. It's an extremely challenging process and requires very difficult decisions and strong leadership. Tedros, I applaud your leadership in steering this essential prioritization. This process is fundamental to ensure that WHO will survive these challenging times. And WHO must do whatever it takes to adapt to a new reality. I strongly believe that WHO will come out of this process stronger and even more resilient. Germany will support WHO throughout the process. But this is also a very difficult process, and it raises many questions. Which WHO functions and programs are essential for the global health of all? Which functions could maybe be better implemented by other actors? Which functions must be deprioritized in face of this new financial reality? These are essential questions that we as a member state must also ask ourselves. As the lead ministry for WHO, we, the Ministry of Health, are consulting with our health experts and will actively engage with your reprioritization processes. In our view, WHO must continue its essential work to implement its mandate and work where it has been in comparative advantage and technical expertise. Let me name a couple of important functions. First, its normative and standard setting role in setting health standards, guidance, and regulatory oversight. Its leading and convening role in global health. Its leading work in emergency preparedness and prevention and response, including the work on surveillance and the work that is done here in the hub. I cannot stress the importance of WHO's role in preparedness enough. Preparedness, prevention, and response will not happen without a strong role of WHO. And health emergency programs are currently under threat, and core functions must be upheld. Global health security also means human and national security. I also look forward to hearing views on these questions by our experts on the panel later on. While these are challenging times, these processes also come with new opportunities. Opportunities to become more efficient and implement governance reforms. Opportunities to reduce duplication. Opportunities to increase the German global health footprint in Berlin by strengthening the role of the WHO hub. And opportunities for member states to show leadership themselves. As a member states, we must also face a new reality. First, we must continue to support WHO politically, technically, but also financially. Politically, Germany will continue its unwavering commitment to WHO as a cornerstone of global health governance. We stand by WHO in these difficult times. As you know, a new German government will be formed soon. I'm part of the negotiation processes, and I will do my best to ensure that global health will continue to be a key priority for the new German government, and I'm very hopeful that this will be the case. The discussions so far have been very reassuring, and I'm certain that WHO will be supported by the new government in the same way it was supported by the old government of which I was a part. I'm very much looking forward. There will be a shared future by Germany and WHO again with the new government. Technically, the US withdrawal from WHO has been accompanied by the loss of vast technical expertise that we all have relied on. This is a big loss. But it's also an opportunity for us as member states to step up our technical support. In Germany, we have substantial technical expertise in many relevant fields, and we will use this technical expertise to support you wherever we can. Number 3, financially, the US withdrawal from WHO has left a vast gap global financing that no single member state can fill. Therefore, we must find ways to work more efficiently given the new financial reality. But financing WHO also means investing in a healthier future for global health and each of our national healthcare systems. As member states, we must therefore work together to ensure flexible and sustainable financing to WHO, and an increase in assessed contributions is an essential step to take us there. As you know, Germany has always played a key role in the proposed assessed contributions increase. Given the ongoing process of our new government formation and budget restrictions, providing new financial support is challenging. But in difficult times, every euro, every dollar counts. Therefore, I'm delighted to announce that Germany will provide 2 million euro to WHO as of today, with a view to provide additional support in the future to come. I kindly ask you to join me for the handover of the already signed contract for a photograph. Thank you.
I'm learning German and I can prove that. Gesundheit ist ein Menschenrecht. I think that's a very relevant one. Vielen Dank. Dear Honorable Minister Karl Lauterbach, my dear friend, dear Oliver, and dear Katharina, distinguished guests, dear colleagues and friends. Good afternoon, and it's an honor to be back in Berlin. They say in a crisis, you find out who your friends really are. And over the past several years, Germany has been a strong and a steadfast friend to WHO. I thank my friend Minister Lauterbach and the German people for the additional contribution of 2 million euros you have announced today. This builds on the significant pledge of 240 million euros that Chancellor Scholz made at the World Health Summit last October as part of the WHO investment round. My friend Karl, we're deeply grateful for Germany's support, your partnership, and your leadership in global health. And I was very much impressed when I entered this house. And thank you so much also for making this house really moving from strengths to strengths. Thank you so much. And this, as you know, is a game changer for the World Health Organization and for global health. And we're committed to using these funds in our global mission to promote, provide, and protect health, and to keeping all countries, including Germany, safe from the threat of outbreaks, epidemics, and pandemics. These funds are an investment in a healthier and safer world, and therefore in a healthier and safer Germany. One of the most obvious symbols of the strength of our partnership is this building, the WHO Hub for Epidemic and Pandemic Intelligence, which I had the honor of opening with Chancellor Merkel in 2022. The hub was created to address one of the key weaknesses exposed by the COVID-19 pandemic, the need for stronger public health intelligence globally to identify and respond to threats faster. Since the hub opened, the early warning system that we operate here, called Epidemic Intelligence from Open Sources, has tripled in scale to include 103 countries and has integrated AI technology to make identifying public health threats more efficient. Beyond these walls, Germany's support for the WHO Contingency Fund for Emergencies enables us to respond rapidly to emergencies such as the recent earthquake in Myanmar. Germany has also provided vital support for WHO's work in humanitarian crisis in Ukraine and Yemen, and for the response to outbreaks, including the current Ebola outbreak in Uganda, and for our work to eradicate polio and address antimicrobial resistance. I thank you, especially Carl, for your support for the Global Health Emergency Corps, which we initiated during Germany's G7 presidency together with Bill Gates. That work is now coming to fruition, with a major exercise beginning tomorrow. Exercise Polaris to test the capabilities of the Corps. Germany's support is more important than ever, following the announcement by the United States that it plans to withdraw from WHO and reductions in official development assistance by some countries. But of course, the US withdrawal from WHO is just one part of a much bigger and much bleaker picture as we witness the demolition of parts of the global health architecture. The sudden dismantling of USAID is causing havoc in countries. So far, 50 countries have been affected, with severe disruptions to programs for HIV, TB, malaria, immunization, polio, and health and humanitarian emergencies. WHO is working with our partners to help the most affected countries as best we can. At the same time, we have been working hard to assess the impact of US withdrawal from WHO and to consider how we adapt in response. After I became Director General in 2017, we began a process of transformation, identifying weaknesses and taking steps to address them. One of the major risks we identified was WHO's over-reliance on a handful of traditional donors, including the US. Since then, we have taken several steps to address that risk and broaden our donor base, and as Carl said, Germany has played a key role in that process, especially leading the sustainable financing part of the transformation. These measures are making a difference, and in the long term, will help to make our financing more secure, diverse, and sustainable. Nevertheless, the sudden withdrawal of the US funding and reductions in funding by other member states have still left us with an income gap of almost $600 million this year alone. We have responded to this crisis with a three-pronged approach based on cost containment, resource mobilization, and efforts to engage the US and other donors. All these measures have helped us to narrow the gap. Nonetheless, we now have no choice but to reduce the size of our work and workforce. As Carl said, the reduction will be done carefully and strategically, based on a prioritization exercise that we are now conducting to ensure we focus on our core functions, core mandate, leverage our comparative advantage, and deliver the greatest possible impact with our reduced resources. Everything is on the table, including merging divisions, departments and units, and relocating functions. Although we face a very challenging situation, we see this as an opportunity to reshape the organization, to make it more focused on its core functions, more empowered and more independent, as Carl said. Even as we adjust to our new reality, WHO is continuing to do what it was established to do, supporting countries to strengthen their health systems, scanning the world for signals of outbreaks and other emergencies, and bringing countries together to meet shared threats with a shared response. That's what will happen next Monday, when our member states will meet for the final time to negotiate and hopefully conclude the pandemic agreement. The pandemic agreement arose from the recognition during COVID-19 pandemic that a global emergency needs a coordinated global response. We have come such a long way. Countries have worked hard in a spirit of collaboration and compromise, and there is now agreement in almost all areas. It's vital that countries continue in that spirit to conclude the agreement in time for its adoption at next month's World Health Assembly. At a time when isolationism is in vogue and multilateralism is under assault, we need a strong signal that in these divided and divisive times, countries can still come together to collaborate and find common ground. The pandemic agreement can be that signal, and we seek Germany's commitment to making it a success. Next Monday also happens to be World Health Day, the 77th anniversary of the day the WHO Constitution entered into force. Like the United Nations, of which we are part, WHO was born of the recognition that the only alternative to global conflict was global cooperation. The WHO Constitution was the first instrument of international law to affirm that the highest attainable standard of health is a fundamental right for all people without distinction. Not health for some, not health for most, not health for the rich and powerful, but health for all. That's the right for which I and the dedicated, committed people I'm honored to call my colleagues will continue to work every day. As always, like to say, which I first said it, Gesundheit ist ein Menschenrecht. I didn't memorize my speech, but I that part. Thank you once again. Thank you to you, my dear friend Karl, and to Chancellor Scholz, to the Bundestag, and to the people of Germany. Vielen Dank. Thank you so much.
Thank you very much for those very inspiring words. And now we're going to shift a little bit in our agenda. And when I came to Berlin a couple of years ago, and I first got to know the Global Health Hub Germany, I was really impressed. It's a very unique space that brings together different parts of society to talk about global health matters. And I wonder whether this actually is a unique space where for Germany, I don't think many other countries have such a space. And so in that spirit, I'm really delighted to have 3 speakers come and join me on stage to give different perspectives of global health from different aspects of German society. So I'd like to invite those guests up, and I will introduce them once we're all sat down on the chairs. So please. So it's my pleasure to introduce our 3 speakers here today up on stage with me. First, we have Professor Beate Kaupmann. Beate is the Scientific Director of the Charité Center for Global Health. Sitting next to Beate is Mr. Roland Godet, who's the chair of the board of the German Health Alliance and co-founder and CEO of the Virchow Foundation of Global Health. And to his left is Dr. Maike Riebau, who's the head of advocacy and policy at Save the Children Germany. Please, a quick round of applause. Thank you. So, Beate, I'd love to hear your thoughts on global health in 2025.
Thanks very much. Is this on? It's on. Okay, perfect. Well, thank you very much for the kind invitation. First of all, dear Dr. Tedros, Ms. Minister Lauterbach, Dr. Maike Riebau, Roland, Oliver, dear organizers, friends and colleagues, all protocol duly observed. Thank you for asking me to reflect the academic perspective here today and to share a few thoughts as a professional with many years of collaborative research experience in Africa, mainly in infectious diseases, tuberculosis, and vaccinology. Our work has been funded primarily through governmental organizations in the UK and EU, and I've had many interactions with partners in WHO, mainly via technical advisory groups. A lot has already been said and written about the consequences of the imminent exit of the US from the WHO. Suffice to say that this regrettable decision represents only one part of the new US government's strategy to undermine evidence-based public health policy in general and global health in particular. In addition to the WHO exit and the resulting loss of funds, the equally detrimental accompanying parts are the erosion of science funding and the restrictions of academic freedom in US universities and the degradation of public health institutions like the CDC, not to mention the devastating impact on humanitarian support in low-income countries, the consequences of which are already counting in lives lost. All of these four pillars are crucial for support of health in its global dimension: WHO, universities, public institutions, and humanitarian support, and are being systematically undermined. To sum it up, it's a toxic cocktail. Not only will it lead to the loss of life, but the very surveillance platforms that allow us to measure the detrimental impact of these actions, and also this is method in the mayhem. Ultimately, this will hurt not just the WHO and health worldwide, but also the geopolitical relationships as we have come to know and trust them, and in due course, no doubt, the USA itself. But I'm going to focus now in the next few minutes on the interactions between science produced in academic institutions with a focus on Germany, and the interactions with the WHO and how I see the role of the German government in supporting such interactions. No doubt, this support will be vital to antagonize the toxic cocktail and its consequences. Back to first principles. Science underpins everything the WHO does in the end. The evidence base that underlies the decision-making in the organization is the core of WHO in all of its policies, crisis management, and global health strategies. The input into that content of evidence-based policies is based on scientific studies. And these are provided by academia and its scientific experts, plus data analysis following a system of rigorous, systematic, and peer reviews. The members in various technical committees and task force represent academia and public health agencies. And I will now give you 3 examples which I hope can illustrate the triangle of interactions that I see between science, academia, on one end, WHO core on the other, and the funding support provided, including from the German government. First of all, and it was briefly mentioned, the key task of the WHO in standardization and regulation of drugs, vaccines, diagnostic, and reagents, where public agencies and organizations like the Robert Koch Institute here in Germany, the Paul-Ehrlich Institute, to name just 2, play a leading role in providing the expertise in the advisory groups. Even though they're not universities, these organizations are also rooted in science and are supported via governmental funding from Germany. And this needs to continue unabated, and Germany has a leadership role to play here. My second example is WHO's expanded program of immunization. I'm a vaccinologist, so this is really close to my heart, which saves 4 million lives of children every single year. And the threat of Gavi underfunding is really not to be underestimated. The underlying science with regards to pathogen surveillance and clinical trials and what vaccines might be used safely and effectively has been delivered by academia, and I had the privilege to be involved in some of these decisions with products mainly developed by industry. And there, Roland, you will no doubt comment. The scientific evidence for a vaccine to be included in the WHO recommendations is discussed in the Strategic Advisory Committee of Experts in Vaccination, the SAGE committee, and its members are by and large people from academia. None of them is from Germany. German experts are not equally represented in many of the WHO committees, and one out of a recent assessment conducted by GLORA, which is the German Alliance for Global Health Research, also funded by the German government, only 70 of the overall 3,500 members that we could identify on those technical committees are actually from Germany. There are reasons for that. I'm not going to go into that in detail today because it takes a long time. My recommendations here would be that Germany needs to support its experts in these types of committees, their science and their time and training and possible secondments. The third example really relates to where we are tonight. And the pandemic preparedness work here at the WHO hub in Berlin fills a critical mission of WHO, as Dr. Tedros also already summarized, which is to combat epidemics and pandemics. And I want to use this opportunity to illustrate how academia here in Berlin and WHO have worked together in the recent years, as I believe we set some examples on how we can find new and synergistic ways of working together and get the most bang for our bucks. Our academic team at Charité participated in the WHO Hub's exercise to set research priorities here for the Hub. These have recently been published, you have seen them, and they provide a framework for our synchronized interactions now. Better diagnostics and better quality of data are right at the top, and this is core business for innovation also at our universities. The early intelligence for open source surveillance activities set by the Hub, the International Pathogen Surveillance Network, and the National Public Health Agency Initiative all represent opportunities for academic collaborations, and we are now in the great position to have several PhD projects embedded in such activities that are jointly run by supervisors between the WHO Hub here and the Charité. The Hub has now several young international scientists who are enrolled under joint WHO and academic supervision. In addition, we have just launched a visiting fellowship program between the WHO Hub and Charité, where successful applicants will work on topics of mutual priorities and will share, again, supervision and output. I believe that these new creative partnerships with a clear focus on priorities are initiatives that Germany could and should support, with funding including, and that they pave the way for more integrated form of working that are needed now. In conclusion, whilst the available money has decreased, global health needs unfortunately have not. In fact, the opposite is the case. In my view, academia and WHO, supported by governmental funding agencies, should now focus our efforts on the biggest impact on global morbidity and mortality. Now is not the time for pet projects. The prioritization exercises that are conducted by WHO and also in Germany everywhere at the moment should try needs-driven and actively informed country-level stakeholder perspectives. This would also facilitate more equitable ways of working between German academia, German funding, and low and middle-income countries in what I would like to call the ethics of global health 2.0. If Germany and the new government can then financially and strategically support such mutually prioritized areas, I believe we have the biggest impact on efforts to address the most pressing challenges ahead. And after all, that must be to save lives and livelihoods, no matter where people live in the world. Thank you.
Thank you very much indeed, Beata. Those are very thoughtful and thought-provoking words. And I would also like to thank you for the great partnership that we have with the Charité, which really would simply not be possible without us also being here in Berlin. So it's really a pleasure to hear from you tonight. Another close collaborator, Roland, it would be great to hear from you about your perspectives on global health transitions in 2025.
Yeah, thank you so much, Oliver. Let us be very clear in facing this situation. The Trump administration has, in an unprecedented manner, abandoned values that have united us in the past and that we in Germany and Europe continue to share to a large extent. It's empathy, respect, solidarity, mutual trust, long-term reliability, all interconnected to each other and fundament for true partnerships as well as unconditional humanity. When announcing the complete disbanding of USAID 5 days ago, US Secretary of State said, the foreign aid programs will be redesigned according to what is best for United States, end of quote. Betting on exclusive own benefit contradicts any cooperation and partnership spirit, and while horrifically putting millions of lives worldwide at stake, this bet is doomed to failure for the US itself. The world, and we cannot accept this abrupt stop of services and programs the size of billions of US dollars and the support of WHO. Thus, like other countries, we have to ask, what role can and must we play and how can Germany support the WHO? And let us first look to what already is in place to support WHO beyond money with strong research and networks, including to where the private sector is involved. Germany traditionally features strong, excellent, internationally oriented and connected academia and research, including the universities. The Helmholtz Association with its 80 national research centers closely adhering to the SDGs, Max Planck, Leibniz and Fraunhofer institutes with many health innovation-related research activities, and the latter with a strong private sector funding share. Modern prevention plays a much increasing role here. German actors from all sectors and government have shown foresight in creating an active, interconnected ecosystem of German global health engagement. The World Health Summit has achieved great success for 15 years in bringing science, politics, business and civil society from worldwide together with the WHO as co-organizer in 2022. In addition to the German Alliance for Global Health Research, Beate, you mentioned already, the Global Health Hub Germany, Charité Center for Global Health, Virchow Foundation, and others like your organization, Save the Children. This ecosystem also includes the German Health Alliance, a private sector initiated blueprint for multi-sectoral cooperation. German Health Alliance broad-based expertise from 120 member organizations far beyond pharma, medtech and diagnostic and across sectors allows for systemic perspective and strategies. And GHA partners include, for example, UNFPA, Unite Global Parliamentarians Network, Global Sepsis Alliance, Global Surgery Foundation, the Health Innovation Exchange in Geneva and many more. And together with WFA and Spectaris associations, we have established the concept of health partnerships aiming to achieve, in close cooperation with partner countries, a strengthening transformative impact to health systems with pillars related to NCDs, women health, pandemic preparedness and response, primary health care and capacity building. Briefly back across the Atlantic Ocean, it's very important to maintain and build bridges to those in the US who still share our values. And in this line, with our working group North America, we have much increased activities, just conducted a delegation travel to the US. The Global Health Policy Lab, supported as well by the private sector, aims to be the leading AI-enabled platform for health policy making by making transformation of science and evidence-based recommendations into concrete laws, policies, awareness campaigns and other political intervention, a universal reality towards better health for all. Filling the gap left by the US means that the EU needs to follow some own ways, and key will be a consequent translation of the European Global Health Strategy towards tangible implementation. The One Europe for Global Health initiative, comprising dozens of organizations from all sectors with private sector engagement, including the German Health Alliance and Coordination Committee, is aiming to take a leading role with a flagship project establishing a world network of one sustainable health institutes. This has started off actually with a strong French-German axis and now showing a wide European participation. Strong financial support from the EU would be wise and needed, as such network will be pivotal in integrating the interlinkages of human, animal and environmental health into European as well as international health strategies. These activities can provide strong support for WHO in many ways and concentrate more than in the past to where collaboration with WHO can create synergies. The WHO pandemic agreement to manage future crises in a more coordinated way needs to be jointly shaped as opportunity to stabilize global supply chains and to create investment incentives for research and innovation. In this entire context, WHO can play an increased crucial role in scaling up successful blueprints, especially under its mandate to ensure medicines, vaccines and other health products are quality assured, safe, effective and accessible to all populations while helping member states develop robust, resilient and reliable regulatory systems. In this time of crisis, a systematically deepened, frequency increased exchange of WHO also with the private sector, is obligatory, same as a much intensified joint mapping and consequent utilization of already available initiatives. A WHO liaison office in Berlin, for example, interfacing with the German global health ecosystem would strongly facilitate this. Under tight budgets, joint innovations in structures and mechanisms are especially crucial. Thus, we all somehow must undergo a sort of reforms. Please bear with me one more minute. Germany will invest over the next 10 to 12 years a total of around 1 trillion euros in civil infrastructure and climate protection, military and defense. A country strong enough to make such investments, of course, has a possibility and responsibility to taking even stronger lead in closing WHO's severe financing gap. An order of magnitude of around 0.3 to 0.5% of the aforementioned amount seems appropriate, just to make a suggestion. And this will be even more efficient if part of this is utilized to further improve the mentioned collaborations and synergies with existing institutions. This would shape an extremely worthwhile investment for Germany, as it would minimize economic risk, pandemics, lever economic potentials, contribute to resilient health, economic and financial systems, to global health and own security, to more secure socio-economic development in the global south, essential for a viable economy and job creation locally, and consolidate multilateral structures. Supporting WHO is investing highly effectively into our shared values, taking into account the interconnectedness of health, environment and security, all inherently global. Not doing enough for global health and WHO would clearly be an irresponsible failure in system thinking, which we cannot afford at all. Thank you so much.
Well, thank you very much indeed, Roland. And I've been incredibly impressed by the vibrancy of the engagement from from industry here in Germany in global health. It's been really, really interesting for me, having moved to Germany just a few years ago. And I think it's something that we could do more of and should do more of in these times of global health transition. So thank you very much for a call to action for us, and one that we'll be following up with for sure. Now, I'd like to pass over to our third speaker this evening. And Maike is going to talk about her perspective of the global health transitions in 2025 from the non-governmental perspective. Over to you, Maike. Thank you.
Thank you so much, and thank you so much for having me tonight. I will speak on behalf of civil society and, of course, on behalf of Save the Children, where I work. So today we are talking about the WHO and the role it plays in the global health system as a whole. But let's pause for a moment and take a step back. Because, of course, global health is but one piece of the intricate international system. And right now, this whole multilateral system is in crisis. It sometimes makes me think of a house on fire, and while the flames are already going into the kitchen, destroying the carpets and the clothes, we are still trying to figure out what to save first. The passports, medicine, or should we go outside and try to call for help, minimize the damage? And of course, this is an impossible, scary task. And while this image might seem a little dramatic, that is exactly what's going on. The multilateral system is in crisis, and alongside crucial actors like WHO and many other civil society actors. And when we at Save the Children look at the impact, we look at what it does to children, obviously. And we are concerned about the lives of the world's most vulnerable children, as cuts in foreign aid stop vital work in dozens of countries when children's needs have never been greater. The extent and the effect of the cuts of USAID and other key donors have already had are immense. And what we at Save the Children already observe in the countries where we work is that in more than 40 countries have already been impacted across Africa, Asia, Latin America, Europe, and the Middle East. And this is threatening health, nutrition, and education programs for millions of children. It means that these children are facing closed clinics and going without meals. School lessons are no longer taking place due to a lack of materials and teachers. We estimate that between 8 to 12 million children and their families we have supported so far are affected. So let me just point out some concrete examples of what this means in concrete terms. In Sudan, 300,000 people lack food that they urgently need at a time when catastrophic hunger is already claiming lives. In the Democratic Republic of Congo, hundreds of thousands of people are no longer being treated for diseases like mpox and cholera by us. And in Afghanistan, and several healthcare centers in the country have already been shut down, where, by the way, USAID funds for health were 3.5 times higher than what the Taliban government's spending on health. WHO's role is pivotal in shaping global health policies, providing support to national health systems and driving initiatives that have already been mentioned by my previous speakers and that aim to improve the well-being of children around the world. It plays a key role in driving action to tackle global health challenges and accelerate universal health coverage through a primary healthcare approach. The US withdrawal from WHO and key global health initiatives like Gavi and likely the Global Fund represents a critical juncture for global health policy. Germany, with its robust health infrastructure, commitment to multilateralism, and strong civil society, can play a leading role now in filling the vacuum or at least cushion the gap. Because, as you have already said, no one is able to fill the gap completely, but we all need to work together now to look what is most important and at least soften the blow. Civil society in Germany has a critical role to play in this process by advocating for policies that promote equity, innovation, and environmental sustainability in global health. And we're really happy and looking forward to see this commitment in the new coalition treaty and hopefully also this type of commitment as part of the budget process. Germany, alongside the EU, can also work to reinforce the importance of multilateralism in global health governance, particularly in defending the WHO's role as the central coordinating body. So, coming back to the image of a house on fire, what we do need to think is both short and long term. While we have to accept the fact that for now, we know that lives will be lost, sadly, and we won't be able to save all that is dear to our hearts, not within Save the Children and not within some of the organizations that we work with, be it at WHO or other strong partners. We also already see that some of our local partners are suffering the most, and we are very keen to see how we can support them and the local communities there. Because today we have all the German and international civil society here in the room, but of course the local communities and organizations are those that are not here. So we can't dwindle in our support for WHO or global health as a whole, and Germany right now must remember it is a model for the way many states are acting. At the same time, we need to start thinking about the future right now, and obviously also build a house that is more resistant to stress and less reliant on just one foundational cornerstone, and think about how to include those local communities when we start to building back. Thank you.
Thank you, Maike, for sharing those perspectives from the non-governmental organization perspective, and for WHO, a vital partner all around the world, working on the ground with communities. And so thank you very much indeed for those comments. Can I have one final round of applause for our speakers? Thank you very much. We'll pick it up later. Thanks, Roland. So thank you very much, everybody. We're coming to just the final concluding reflections, and we have an opportunity for Minister Lauterbach to provide some closing reflections, followed by Dr. Tedros to also provide some closing reflections on some of the conversations that we've had this evening. So may I invite Dr. Lauterbach. Thank you.
Well, thank you. I will be very brief. In essence, what we have been seeing now is a tragedy developing in front of our eyes. If you look at the cuts in the vaccination programs, millions of people rely on these programs and they have no other way to go, as a matter of fact. So therefore, what Professor Kampmann was saying is actually exactly what is happening. And in my opinion, it is an unforgivable lost opportunity. We were moving forward on many of these issues, and we are now falling behind basically for unacceptable political turmoils that we can only hope that they will be finished soon. But in these dire days, the only thing that we can do is basically cling together. And what I can do as the acting Minister of Health, I will do my very best that these needs are addressed in the coalition context and that they will move forward into our new government. This is what I can promise here as of today. I also would like to thank Dr. Goede for the strong support of industry, as a matter of fact. Industry is playing a major part already, and it is doing so increasingly, technically, financially, in many ways. That's a very, very important alliance on which we increasingly have to rely, as a matter of fact. And I hope there will be times when we can share back, as a matter of fact, because we will not forget what you have done, as a matter of fact, in such important days of crisis. So thank you also for your leadership, also for the leading role that you have here in Germany, bringing together so many people collaborating from industry, from the public and from the private sector. This is very important. Thank you, Roland Goede. Thank you. And ultimately, if you look at the biggest losers of the pandemic, children were the biggest losers, as a matter of fact. They lost their opportunities. They lost part of their education. They lost part of their lives, as a matter of fact. They lost very often even their parents, and they are now very often even suffering from long COVID, which is horrible in particular for children. And if you look at the crisis today, it is again children that are suffering most. So therefore, Save the Children is indeed extremely important in its advocacy role, and thank you for your leading work here. As a matter of fact, this is to live up to these challenges is a very important obligation for us, which we take very seriously, and I was very impressed by the way you described actually what is going on, as a matter of fact. What is going on in terms of hunger is back, as a matter of fact. Under-vaccination is back, as a matter of fact. Diseases where we were moving forward, like tuberculosis, which we had an opportunity to end for many, many years. It is basically a human mistake not to have ended tuberculosis by now. And we are now in a time of rollback, as a matter of fact. Very often children suffer from tuberculosis and they are not living up to their potential development. So this is also reminding us that we have to stand together in these days and months of crisis. But let me finally finish on a hopeful note. I think ultimately reason is going to prevail and we will live together into better times. And I'm fully convinced that these days of crisis, later we will look back at them as days of crisis where we stood together, but where we ultimately lived up to the challenge, and we will look forward to a better future. I thank you.
Yeah, thank you. So I think my friend Karl had already said everything. I came to thank the three speakers, to Beate, to Roland, and to Mike. Excellent messages. And I'm really glad to hear your strong support to global health. And that's actually very much a message for me, what Karl said. It gives me hope. the three of you, all that you said. And also not only hope, energy and inspiration. And thank you so much indeed. Vielen Dank. Then one thing I will share with you is when, I think it goes along what Roland said. I met a foreign minister in Munich. The last Munich was very, very sad for me. I started attending Munich when I was foreign minister. And since then, I am a regular, attendee. And I enjoy the Munich Security Conference. But I was in the room in the first day, and I was so sad to see, the serious crack actually happening between good friends and alliances, because alliances, friendship is priceless. But that was not the part that, I kept that really impacted me even seriously was many leaders, many prime ministers, presidents have spoken. And most of them were speaking about increasing their military expenditure significantly. And that was very, very sad to see. Of course, they were saying they have no other option now because there is trust deficit, reliability is down. We have to prepare ourselves for any eventuality. Then I spoke to a European foreign minister after the presentations and so on, and I asked him, so how are you going to prepare? He said, we're assuming the worst and preparing ourselves, and you know how the geopolitics is shifting. Then I said, I fully understand. But then I told him, okay, if you're saying you have to prepare based on the worst for anyone who might invade you, then how about an invisible virus that might invade? So I think you have to put that into equation because an epidemics or pandemics like COVID brings economic, political, and social instability. So I think thinking the worst about it and preparing for that eventuality also is the right approach. And he agreed. Yes, it's true. And it's actually, that's why we call it health security. And viruses don't respect borders. So you're right. And I think we need to have a balance, strike a balance. And that's exactly what Roland said. And we have agreed and parted our ways with a positive note. So that's just what I wanted to share, because governments will have priorities, they will have good reason. It will be very difficult to say otherwise on that, but probably striking a balance would be the right approach, and that's what I would expect. So with that, I concur with what my friend Carl said for the rest of the things. And thank you so much again for joining us and for your support. And I will leave this forum with hope, because that's, I think, what you underlined, Carl, and that's what should stay with us. Even during difficult times, I think hope can help us to move forward. And in any challenge, there is opportunity. And there is a silver lining in any cloud. So that's what I will take from this meeting, and thank you so much again. Thank you. And I'm glad to see my daughter growing up. I call the hub also my daughter. So our daughter, our daughter. And one thing, with the expenditures and so on, relocation, we're thinking now, part of some of the departments in WHO in Geneva also, we're planning to move here. I just wanted to give you a heads up, so you have to keep some rooms for some new guests. Thank you.
Great. We just want to thank Dr. Tedros and Minister Lauterbach for your inspiring words, as well as this clear commitment of our ongoing partnership. To our speakers, Beate, Micah, and Roland, Thank you so much for your very thoughtful observations. And to the audience, I do want to ask you if you could please remain in your seats for just a little bit longer while the minister and DG have to move to the next stop on their very important schedule. And then after that, I have the enviable task of inviting you to stay on for a reception. And I want to thank everybody online and everybody in the room, and have a great evening.